just always had bad knees. My knees have bothered me since I was in high school and in college, and I have been very active my whole life, and so they have progressively gotten worse. And so I have just been doing things, injections, and slowly over time I have been cutting out some of the things that I love until I got to the point that my doctor just said, let's go see a surgeon. And so that's when I went to Dr. Calton. Mom had Dr. Calton do her knees, and so that's why I chose him in the first place.
Michelle came to me a couple of months ago, and she was clearly concerned about the knee pain that she'd had for a long time. She couldn't be active anymore. She couldn't do the things that she'd always loved to do. Her mother had had arthritis and had had previous surgery, and so I think she knew that she was probably going to end up needing surgery, but she was concerned because she was so young. So we looked at her x-rays and discussed her history, and she'd had a lot of conservative care and nothing was working. And it got to the point where she was just sad that she couldn't be active and do the things that she wanted to do. She had severe arthritis, and once the conservative options have been tried, your next option is to have surgery, or you just live with it. And there are ramifications of living with arthritis because muscles won't fire to the same degree, activity typically diminishes, bones soften, condition, just your overall health worsens. And so Michelle decided to have surgery.
You just made it seem really doable, and he said to me, this will be the best decision that you've ever made, and already I can tell that he's right. So I guess ultimately the benefit is that he gave me courage. I feel very confident. I really feel like he knows exactly what he was doing. I feel very confident in his skills. He called me before I had my surgery. What questions do you have? Let's have a discussion. I know you're concerned about this and that meant a lot to me because I was really nervous to do it. And so I felt like that said a lot about his attentiveness. He came right in and saw me after I was awake and checked on me, and had texts from him and Cody checking on me after. They honestly made me feel like I could call up there anytime or I could text anytime, and they were awesome.
I tell all patients knee surgery is not easy and it requires patient participation. And Michelle's surgery went exceptional. Her knee balanced really nice. We were able to put the implants in just exactly like I had anticipated, but that still doesn't mean the surgery and the recovery won't be hard on patients.
I went to him 2 weeks after surgery, and I felt like I was doing really well, and I was really feeling pretty good, thinking, oh, I'm doing really well. But he has this fun side of him, but then he also has not a hard side, but he was very real with me and said, you are only 50 and you should be here. He was very nice and very respectful, but he basically just put it out there and said, this is where you should be, this is where you are, you've got this much to go, and just told me exactly what to do, and I have faithfully done everything that he told me to do, and I believe that's why I'm where I'm at.
She's tough. She really got into therapy and did exactly what we asked her to do. She came back for her post-operative visits with a big smile on her face, even though I know and she knows that she's suffering and it's not easy, but she just kept her chin up and she worked hard and did exactly what she was supposed to do. And she got her motion early, and that's really one of the big important goals, is to get motion early. If you control swelling and you work on your therapy daily, then you do well. And Michelle was a great patient, and she's young and fit and strong and has a lot of energy.
I think the most valuable part is that I kind of feel like I have a new lease on life. Like I feel like I think you reach a certain point in your life where you think, well, now I'm this age, and so I'll have to start tapering down.
I used to could.
Yes, yeah. And when I went to see him, he just lit a fire under me. Like he gave me courage and to do this, because to me it seemed so huge at my age.
Michelle is a really good example of a young patient who is clearly afraid of a major intervention like knee replacement, But she'd gone through all the conservative measures. She'd had shots and she'd tried exercising, and she'd already given up some of the things that she loved to do. And so here she was faced with a major decision, and she had a lot of trepidation making the decision to have a knee replacement. And after we talked about all the options, I think she realized that she wasn't going to be able to live a healthy, active lifestyle, one that she enjoyed, with the knee that she had. And so there really, for her, there wasn't a great option other than go ahead with surgery. I've got knee arthritis. One day I'm going to have to make the same decision, and I think Michelle's decision-making process is really kind of like mine. You go through all the treatments that you can, you try to fix it and live an active lifestyle, but eventually I think that decision is made for a lot of patients just because of the facts that they cannot do the things that they want to do.
So I'm only 6 weeks out, and so I'm certain that it's going to get better and better. But as of right now, I know I'm a dental hygienist, and so I stand up after I clean my patients, and I take the patients to the front or run to the back to get their toothbrush or whatever. Every time I would stand up, my knee would just swell the minute I would stand up. And then I would have to limp in to get the things or to take them up front. It was just getting to the point where I just couldn't do a lot of the things. I would ski, and I was down to doing maybe 3 runs and couldn't even walk. And so I just, already I've noticed that I just got back from walking my dogs, and I took them a mile, no swelling, everything's good. I haven't done lunges, forward lunges, for a couple of years. I do backward lunges, but I haven't been able to put weight bearing on them. And I'm doing lunging, I'm going up and down my stairs with no problems. So already I can see a difference at 6 weeks.
I'm really excited for her because she's going to be able to hike and bike and ski and do all the things that she wants to do. And I think she mentioned that she hadn't been able to do a lunge in a long time, and I think that's one of the important things in her workout regimen, and she's now able to do that. And to see her smile and to see her optimism for the future.
Are you aware of the technology that he uses to get it just perfect?
You know, it's funny because he didn't explain that to me, but my physical therapist did.
I put my heart and soul into these surgeries, and the technique that I try to offer all patients is a technique where the implants are really customized to the patient's bone and soft tissue, and that combination allows for us to reconstruct knees that are previously bad and worn out and beat up, and put them in stables. My entire career I've tried to improve the ability to precisely reproduce patients' anatomical needs for knee replacement. Early in my career, back in the late 90s, knees were very generic. And I tell patients it's kind of like you go to a shoe store and you have a size 6, 8, 10, and 12, and you just pick one, and that's all you have. Well, I've got a 10.5 triple E foot, and when I get my shoe, I want to have a 10.5 triple E, and that's what I want. Well, I've tried to encourage manufacturing to allow us to do things like that and have size options. And early on in my career, there just wasn't one of the implants or one of the tools that we really needed. And it was a tool that allowed us to customize the rotation of the femoral component. And that may not mean a lot to patients, but that's how the knee is stable when the knee is bent. And that tool, we developed it about 15 years ago, and we still use it to customize the rotation to each patient. And in Michelle's case, we had to do some rotational changes. We had to use a narrow implant, something that would fit her anatomy. And it's really so satisfying when you can take a knee that has a lot of dysfunction and a lot of unique characteristics, and you can tweak it and adjust it so that it's just right. And Michelle's gonna have a great outcome, and I'm really excited to see how active she can become and watch her return to the activities that she's always loved to do.
What would you say to any friend or family member that's considering joint replacement surgery?
I would say do it.
I spend a lot of time talking people out of surgery, those who haven't tried options, who haven't lost weight, who haven't tried shots or pills or a different lifestyle. And I think Michelle's a good example of someone who really fought hard and then made the decision, and now she's almost 2 months into her recovery, and she's already seeing improvements and the ability to do things that she wants to do. So she's a great example for a lot of people about how to live their life before, how to make the decision, and how to recover and do it well and do it with grace. What takeaway can Michelle's experience offer other people? Michelle is a very vibrant, active gal, and younger people can successfully undergo knee replacement surgery. I think it's sort of thought of as something that will happen to older people, but the average ages are now in the 50s, and younger people, for a lot of reasons, are having knee replacement surgery and hip replacement surgery.
For somebody who does need it and had the same fear as you, what would you tell them?
I would tell them absolutely. Yeah, I would say that. And I need my other knee done, and asked him about it just the other day, and I didn't feel pressure that he wanted to do my other knee, which made me feel even more confident in him. He basically just said, when you're ready to do that knee, you'll know it and we'll address it. But so I feel like if you are in pain and you're cutting back on your activities and you're just starting to not enjoy your life like you have it, I would say do it.